Seymour. My name is Sandy. I'll be doing trachea and trach suction for you today. Can I get your name and date of birth? He's going to give me his name and date of birth. Bob Seymour, 2/24/1978. I'm verifying it on his band and on the mark. Okay. I am going to wash my hands. I'm going to provide privacy. Okay, so what I'm going to do is I'm going to do his suction first and then go into trach care because of the fact that it's easier to do it that way. Because suction, if you get all this stuff on the new dressing, then you'll be changing it again, so it was a waste of time. Okay, so before that, I'm going to put the pulse ox on him to check his pulse ox. So got the pulse ox on him. Okay, I am going to listen to his lung sounds. So I'll listen to all his lung sounds. Okay, I'll probably put on some gloves because if I'm gonna be listening to him, I'm gonna put gloves on. I'm gonna listen to all. I would probably just listen over the speaker ones, just like say I would listen to all 4 sounds, all 8 sounds, you know.
Yeah.
Right there, okay. With my stethoscope in the office. So I'll listen to his lung sounds. Okay, I'll count his respiratory rate. So I'm actually going to have him breathing. I could turn him on for your practice, so you could practice counting him. He's pretty easy to count. So count his respiratory rate. Listen to his lung sound. What do they sound like? Okay. Remember, if his pulse ox under 88%, don't suction. Okay. I'm going to assess, make sure he is having no anxiety, no restlessness. Okay, because then I may not want to suction him either. So no restlessness, no anxiety, or anything like that. So he seems to be fine and good and okay so far. So what I'm going to do now is I'm going to make sure I turn all my suction stuff on. Okay, so I turned it all on. I got my suction catheter here. I got my Ambu bag here. Okay. I'm going to make sure I always put everything off to one side so that way I have a big room to spread everything out. Here's my box. What happened to it? Who knows what happened to my box? It should have came right out and open, but somebody was screwing with it. Okay, got my box. I'm gonna put that on the side here. I'm gonna be as close as I can possible to the suction, so it'll be easier. I'm going to check my normal saline bottle or sterile water bottle. Okay, normal saline you can use, sterile water, whatever. I'm gonna check the name, I'm gonna check the date, make sure it's not expired. If I'm opening a new bottle, I would write the date on it that I opened it. Okay? I'm going to get rid of the first drip. Okay, and then I'm going to pour some in there. I brought this over because I was going to use it for my trach care stuff, but I don't need it right now, so. I am going to assess the, amount of gunk that I have to suction, coca, color, odor, consistency, amount. So gloves on. Okay, sterile, clean. I'm going to take his oxygen off him. I'm going to give him 2 breaths. Not going to turn my back on the sterile field. 2 breaths. Take that off. I'm going to take my suction catheter, hook it up to here. I can touch the white piece, I just cannot touch this part. So I'm going to test it. So it should work because I already turned on my suction and everything. Okay, so it's working. Then I'm going to, like I said, some people is able to wrap it up in their hand like that. I seem to can't do it that way. I don't know how people could do it. I can't do it that way. I'm not even gonna try. I'm gonna put it in, and I'm gonna keep going until I meet resistance or he coughs. So once I meet resistance or he coughs, I'm gonna start intermittently suctioning and twirling the thing, okay? Once I do that, I can clean out my catheter. Okay. I'm gonna give him 2 more breaths. I only wanna be in there for 10 seconds, no more than 10 seconds. Go back in a second time. Once I meet resistance, it's going further this time. I knew it went in further. So until he coughs or meets resistance, and then I'll do my little twirl. So if it does go in farther for you guys, just keep moving. You see how I keep moving my hand up? So that way the end doesn't touch the bottom. Clean it out. So I'm gonna give him 2 breaths again. I'm gonna section him a 3rd time. All the matter while I'm watching his oxygen level. Okay, meeting resistance, so I'm gonna twirl it out. Intermittent suctioning. Okay, clean my catheter out. Dispose of my catheter because I'm all done with it. Put his oxygen back on. Should be good. I could actually turn off all this because I'm done with it if you want. You can always turn that off. Okay, now I'm going to go into trach care. Okay, so I'll clean up all my stuff here. Put it in the garbage can, whatever. I'm going in trach here that can stay. I'm going to take off my gloves. These are my sterile gloves. Okay, I'm going to wash my hands. Okay, I'm probably going to put on these gloves. I'm going to assess his site around his trach, looking for swelling, edema, redness, all that stuff, besides the drainage, the COGA. Color, odor, amount, and consistency. Okay? So I'm going to look at that all around there. So now what I'm going to do, I'm going to remove the old dressing. I'm going to look at it. Okay? We're good there. I'm going to, right now, I think I'm good there, so I'm going to just remove my gloves, wash my hands. I'm going to start opening up my tray. Away from you. I think what I'm gonna do, I'm gonna do it this different this time so you guys don't have trouble. So I'm gonna put on my gloves first. Now this is the tricky part because you're already sterile now, right? So I can touch anything in here. So what I can do is I can take out my thing and hold it anyway because I'm sterile. So this is all sterile. So I'm going to just gently just let that drop there, okay? Remember the 1-inch border is considered unsterile. It's sterile right now, but if anything lands on it, it's fine, okay? I could just take, well, that's unsterile, so we're not gonna touch that. Get those out. Get my Q-tips. My gauze. So that's all done there. Now, I'm going to, this is my dirty, this is my sterile. But what I'm gonna do is I'm going to take this, I'm gonna fill up my, remember one's half and half. So fill up 2 of these pockets. Remember, I'm not crushing my sterile filled. I'm gonna do the peroxide, this other half, okay? Then I'm going to, this is my clean hand, so I can touch the outside of this. So I'm gonna unlock it, and I'm gonna pull it out and put it in the half and half, okay? So I got that in there. Now while it's soaking in there, what I can do is I could take the Q-tip, fix this thing here, and I'm going to clean around there, okay? Take it. Try not to unsterile my other hand. Take it, clean around. Like that. Now if I needed to go around it some more, I literally can. I could go like this, grab some more, and I could kind of like, I probably want to switch hands because now I'm gonna really touch them. Okay, I could clean some more if there's more gunk on there. I could clean that. I'm trying to keep this hand as sterile as possible. Okay, wring it out, make sure. And then clean around it. And then I probably want to dry it off. Okay, so this thing should be done in here. So I could touch this end with my sterile, because that's sterile. But this one's not. I'm going to take my brush. I'm going to, you can hold this for test out purpose because it does move. Clean it off. Put in the water to rinse. Of course you go back down. Take my pipe cleaner, dry it. And I can put this back in. Now what you can do is you could clean this first if you want.